dozens of Canadians, each breath is a challenge. The University Hospital Foundation has created an amazing strategic partnership with Boehringer Ingelheim Canada, and we're taking action to help develop solutions for those who struggle to breathe, specifically people living with progressive fibrosing interstitial lung diseases.
By embracing the power of partnership and the diversity of experts in the scientific community, we can develop more innovative solutions.
My husband Ross was diagnosed with interstitial lung disease at the age of 64, and he had been sick for approximately 4 years before his diagnosis. Ross climbed Kilimanjaro. He was on weekly hiking trips with friends. He went from that to barely being able to walk from our bedroom into the kitchen.
Interstitial lung disease is really an umbrella term for over 200 different types of lung disease that cause inflammation and often scar in the lungs. A subgroup of those diseases get worse over time, and they develop a progressive fibrosis or worsening scarring. And the problem with these types of lung disease is that there's no cure for scarring in the lung, and often when it's there, it gets worse over time and can lead to death and disability in many of our patients.
The impacts of PF-ILD on Albertans and on the Alberta healthcare system are significant. The condition requires access to a range of services, and navigation through the system is challenging, particularly for those with less independence or functional loss from the disease. There is a need to come together to optimize patient care across the healthcare system, from testing, assessing, providing care and support, and rehabilitating patients with these lung conditions.
Within Alberta, we have a tremendous opportunity to collaborate, and the way the healthcare system here is designed, it is set up to be collaborative for data sharing.
Through strategic partnerships, we accelerate health innovation projects.
By gathering industry, the public sector, and philanthropic associations, we can address the PF-ILD care gaps in Alberta and work to improve patient care pathways.
I don't think either of us ever thought it would affect him to the extent that it did. Ross was 67 when he died.
With so many patients being impacted by ILD and PF-ILD, there really is no time to waste.
Patients are real people with families and friends, hopes and dreams like all of us, and it is a privilege to come together to develop healthcare solutions in a way that lines up with their hopes and dreams.